Hi, I'm Dr. Alexander Digenis, and I'd like to speak to you for a few minutes about breast augmentations. I'm a board-certified plastic surgeon here in Louisville, and one of the surgeries that we offer in my practice is breast augmentation. We have a long history in breast augmentation because this is the practice of Dr. Norman Cole that I took over in 2001. And he left me about 10,000 patients that he had placed breast augmentation implants in, and these are patients that I continue to follow and take care of. So we have a rich history in terms of breast augmentation. Breast augmentation usually involves a small procedure, usually about an hour to an hour and a half, that involves making a small incision. There are usually three options. For silicone implants, those are one of the two kinds of implants we use. We use both silicone as well as saline or saltwater implants. But the silicone, because they're already filled, usually have to go through an incision that's either underneath the breast in the crease or around the areola or nipple area. The saline implants can be placed under those same, placed through those same incisions, as well as the incision that's made in the armpit. So every patient has a different approach given their anatomy, the nipple areolar complex size, as well as their own desires. So generally, the implants are placed in today's technique, for the most part, underneath the pectoralis muscle. That's the muscle that's over the chest. And so this gives a more natural coverage of the implant and makes the patient look more natural, and long-term tends to improve the chances the patients will keep a soft, supple breast in the future for many years. So we try to, again, personalize each patient's planning as to what's the ideal shape and form. As I'll mention in one of my other video blogs, the breast lift is often added on if there is a lot of droop to the breast, and that involves breast lifting, which involves usually taking out skin and lifting the nipple. But in terms of breast augmentation, the patients usually stay, in my routine, are often an opportunity to stay overnight in a hospital setting for a remarkably low price. And that's usually built into the cost of the surgery. The patients, of course, can go home if they wish, but oftentimes they find that it's a nice distinction of my practice versus other practices, that they can do the surgery in a safe place, which is part of a hospital, with real anesthesiologists under the best care, under the most sterile conditions, and then have the option for less than most hotels to stay overnight, be given intravenous antibiotics, be taken care of, and then re-examined the following morning by their surgeon and by my nurse. And so we give the patients a variety of options that I think distinguish us from other offices, because our main focus is safety. In addition, we emphasize looking at proportions, and we take a great deal of time to measure and try to size the patients and give them the best idea of what size of implant would make them look the most proportional. As I tell my patients, you want to look better, you don't want to look overdone. And I think that there's a lot of that in plastic surgery today, where the surgeon is not advising the patient to give them the best opportunity to find the size and the shape that's most proportional to their particular anatomy. It's all about enhancement in natural proportions. And so we try to give a very personalized and customized plan to each patient, and we'll be happy to see you in consultation and give you that kind of care. Thank you. If you would like more information, don't hesitate to call our telephone number at area code 502-589-5544. Thank you for your attention.